I'm an orthopedic surgeon, sports medicine specialist. My main practice is knee and shoulder scopes. I don't do the big replacements. I don't like blood, to be honest with you. And today we're talking about is going to be pickleball injuries and injury prevention. And I encourage questions or comments. I just feel like we all get a little more out of that than just me talking. So pickleball, fastest growing sport in the United States, and it's actually now the last 5 years in a row. They're thinking now there's at least 50 million pickleball players in the United States. Average player is 35. They break the age stratifications into 3 categories. 1 is 0 to 25, 2 is 25 to 50, and then 3 is 50 and above. Basically a 60-40 split, male to female. And then if you follow the statistics over the last 5 years, 91% increase in injuries. Most common age group is that 3rd age group. 257% increase in hospitalizations. 400 million was last year's data. This year's data is now half a billion in annual healthcare costs. And then we look at mechanisms of injury, and we'll get into this a little more. You know, falls, you're kind of talking about your wrist fractures. Overuse is going to be your kind of tendinitis, tendinosis. Your sudden movements, that's going to kind of be your strain and sprains. Contact, improper technique, and then exacerbation of underlying condition. And I think that's what you were just talking about. You said pickleball didn't cause your knee replacement, but it may have been sort of an underlying factor. Basically, exacerbation of underlying condition. Someone has arthritis and or a meniscus tear that's relatively asymptomatic. Now they start playing all this pickleball, it can suddenly become symptomatic. Just found this chart sort of looking at percentages of overall injuries. Fracture number 1, strain, sprain 2. Then you get into your contusions, abrasions, head injury. And then we look at body parts. Number 1 is wrist, which makes sense because it's caused by fracture. Lower trunk, that's kind of be your back injuries. Leg, head, knee, ankle, shoulder, arm, and face. All right, so a sprain. So this is a tearing or stretching of a ligament, and this is usually caused by kind of twisting or turning or a quick kind of stopping or starting. Sort of specific anatomic locations, you know, the ankle, that's kind of that inversion injury. There's a ligament called your anterior talofibular ligament. That's the most common ligament in the ankle that gets injured. In the knee, that's kind of your famous ACL, MCL. Wrist is usually a fall at an outstretched extremity. And then shoulder is usually the AC joints from kind of recurrent hitting and also a lot of overhead things. And then a strain, this is now your muscle or tendon. It can be overstretched. If you think of someone with like a tight hamstring or a tight Achilles, it can be overexerted. And again, this is the hamstring, the quad, the calf, the shoulder, and also the lower back. And then when we look at these grades, these strains and sprains, we really talk about 3 kind of grades. So a grade 1 strain or sprain that you just feel it. But if you were to get an MRI, it would be a negative MRI, so it's just kind of that initial pain. So as far as treatment goes, we call it day-to-day. You know, if as soon as it's not bugging you, you can kind of go back to it. So like in the NFL, they'll say they're day-to-day. Grade 2 is a partial tear. So you get an MRI and you do see some partial tearing. This is usually treated by rest, and on average, you're kind of looking at about a 4 to 6 week time frame. And then grade 3, that's kind of your complete tear. Depending on what muscle you tear, you know, that may or may not be surgery. And in general, when you do surgery for like a torn tendon, we'll say like a quadriceps tendon, a hamstring tendon, that's usually about a 4 to 6 month recovery. And then overuse injuries. So I guess personally, I think probably this is the most prominent thing I see. In the shoulder, when you do a lot of repetitive overhead activities, you can get something called impingement, which is where the rotator cuff is rubbing on the roof of your shoulder. The elbow, this is kind of your famous pickleball elbow. We also call this a lateral epicondylitis, but it's pinpoint pain on the outside here. This is a structure called your lateral epicondyle. And the reason for this is all the muscles on the dorsal side of your forearm, they all come and insert onto a single point. This is called your lateral epicondyle. And from repeatedly lifting the wrist up, as all those muscles are firing, they're going to put a lot of pain to that one specific spot. So that's your pickleball elbow. Knee, and we've already talked about this, underlying arthritis, underlying meniscus tears. And I believe in active people over 50, we all have arthritis and meniscus tears, but again, they may be relatively asymptomatic, but especially pickleball, when you start to play a lot more on the harder surface, they can become symptomatic. Ankle, this is kind of, rolling your ankle. And once you do it once, it's a little easier to happen again and again and again. Achilles, it's an overuse, and basically the Achilles tendon, it's just tight. And you really, 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 really have to stretch your Achilles. And we'll get into this, but we talk about stretching before and afterward. But when I say may lead to tear, like Aaron Rodgers, when he tore his Achilles, he had been dealing with a calf strain or sprain before. The other night in the NBA final, when he tore his Achilles, he had been dealing with a calf strain before. So when you're kind of getting these aches and pains, when you're getting this tendinitis, tendinosis, that muscle's compromised to a degree, and then you are more prone to completely tearing it. And then wrist and forearm also, that's repetitively kind of supination, pronation, flexion, and extension. And then tendinitis versus tendinosis. When someone has a tendinitis, that's considered an acute inflammation, and that is anywhere from day 1 till 6 weeks out from the symptoms. And then a tendinosis is more of a chronic issue, and that's usually any time beyond 6 weeks. All right, and then we get into treatment as you start to kind of experience these aches and pains. Rice is sort of the famous book answer, rest, ice, compression, elevation. I'll never take credit for this, but I'm not a fan of ice. In my experience, a lot of these injuries are caused from like a tight muscle or tendon. And when you ice these things, ice tends to make things contract or kind of tighten, which if a lot of these injuries are prevented by stretching, I don't know why we ice. I'm a huge fan of heat. I'm a huge fan of heat prescribing it to people, and I'm a huge fan of heat as a former athlete. But heat tends to allow things to relax. So even though we all talk about rice, I guess what would mine be? Rahiki? I don't know. Anti-inflammatories. One thing to know there with anti-inflammatories, your aspirin, your Motrin, kind of all these over-the-counter anti-inflammatories, they're processed through your stomach. So if you take too many of those, you can get stomach pain, which can kind of lead to an ulcer. But Tylenol is actually processed through your liver. So some people, if they have stomach issues, they may do better with a Tylenol. And then now all the modern day things are, if you're taking an anti-inflammatory, let's say every 6 hours, the first 6, take a Tylenol, the second 6, take an aspirin, alternate those two, because then you're not processing everything through your stomach or through your liver.
What about, can I ask a question?
Please.
What about the topical?
Yeah, so the topical things, and what are you asking about it?
Like, is that just as good as taking, to prevent the stomach problems? If I rubbed on, like I.
Aspirin?
Yeah, those.
Totally, yep. So those are more topical, those are more superficial, so they're not going to be systemically ingested like your.
And they work just as well on that spot?
So unfortunately, we don't have a lot of studies on that. Most of those topical things, the active ingredient is something called capsaicin, which is almost like a derivative of a pepper, but basically it is soothing your superficial nerves or numbing your superficial nerves. I think it's good for sort of a local kind of anatomic area. I'm a huge fan, but we don't have a lot of studies to support it.
How about that? How about the dosing levels to get anti-inflammatory response? I mean, you got to go pretty heavy dose.
Yeah, so I think they're saying it's like, I think it's like 2,500 milligrams a day is the max. So, and I think as over-the-counter strength is like 500 the most. But then if I write a prescription for it, I think you can get up to 800. But I think you can do 2,500 milligrams a day in general. Physical therapy. So again, a lot of these strains and sprains, you know, this is a tight Achilles, this is a tight quad. If we talk about these repetitive ankle sprains, you know, this is a weak tendon or ligament. So I think physical therapy for stretching and strengthening is like crucial. Bracing and taping. Bracing, again, an unstable ankle, they make ankle braces, and you could do ankle taping. Unstable kneecap, they make braces for that. Someone with ACL tear over 40, we recommend trialing a brace before considering surgery. And then taping, you know, a lot of shoulder issues, a lot of therapists will put on this KT tape, which probably acts a lot like your topicals. And not a lot of studies on that, but I have a lot of patients that swear by it.
And you just, I mean, how do you know how to put it on?
YouTube. I use it for my kids.
I was gonna say the therapist YouTube, yeah. But whatever ligament or joint is bothering you, they will have a technique for that.
Or come see their therapy.
Or see you.
Yeah.
And then, you know, injections, this is a little further down the line. I guess we could say someone that's having a knee issue, you know, you could always do something called a cortisone. Cortisone injection takes a week to kick in. It'll shrink any swelling, dissolve any scar tissue. It'll blunt the pain receptors. You know, a cortisone injection usually buys you about 6 weeks or so. It does wear off. You do go back to your baseline, but it gives you kind of like a temporary vacation. Viscosupplementation is someone with kind of long-standing knee arthritis. People call these chicken shots or rooster shots. The medicine actually does come from the coxcomb of a rooster. It's literally a gel or jelly. It's 1 injection a week for 3 weeks in a row, and it literally puts like a lubricant in your knee. You don't get the same pain relief as the cortisone, but people say it'll take the edge off the pain and they feel like their knee kind of glides smoother. It's less gravelly. And then nerve root ablation, this is something that's done by interventional pain management. So if someone has like a really bad knee or a really bad shoulder, if their only remaining option is a replacement, but if we want to kind of delay or prevent that, nerve root ablation is where interventional pain management, it's an injection, but they're literally essentially burning the nerves that are causing the pain, and that can last for like 1 to 2 years. And then the last option, again, depending on what the issue is surgery. All right. And then prevention. So, I mean, let's just say someone is 65, they just moved to the Villages in Florida, and they're going to play pickleball for the first time. So things we can do. Number one, you know, consult your doctor, and that may sound a little ridiculous, but You know, today I'm focusing on kind of the musculoskeletal disorders, but if you look at all the pickleball issues overall, you know, heart attacks is like way up there. And you can almost think of pickleball as like a stress test. So sometimes seeing a doctor ahead of time, just getting some baseline labs, it could save you. Stretching. So stretching before, that's a known thing, but now there's a lot of literature that says to stretch after as well. So that's something I wasn't really aware of, to be honest with you. But stretching before, stretching afterward. Because if you're playing a lot of pickleball, if it's a warm environment, you know, if you just kind of stop cold, everything's going to just kind of retract. So that's why they really like stretching afterwards. And that's another reason why I wouldn't get the ice thing. If you're playing pickleball, everything's warm and stretched, and then you just stop and put ice on it. To me, everything's just going to tighten. Acclimate. So we talked about that person, you know, trying pickleball for the first time. Maybe just hit for a half hour. Don't even like play a game. But this is like, you know, I go to the gym every day, but I'll go to the gym the first Monday after New Year's, and there's like 20 times as many people there. They're lifting for the first time in years, and they have a trainer, and they'll lift for like 3 hours, and then they're in bed for a week, and they're like, I'm never doing that again. So acclimate, gradual immersion, baby steps. Cross training. So this is really big. So my main clientele, high school, college, professional athletes, and the modern day trend is these kids play a single sport and they play year round. And what we found is if you're just playing a single sport, you're just using one specific kind of muscle group. So now all the other muscles, all the opposing muscles don't get used. Their bodies are really off balance, and then their rate of injury kind of goes up exponentially. So cross-training, if pickleball is your passion, nothing wrong with going for a walk, or nothing wrong with going for a bike. You're just kind of working those opposing muscle groups. Strengthening, very important. We said the person with the loose ankles, you know, as strong as you can get it. And then the rotator cuff. So when people are doing a lot of overhead activity, they're getting the shoulder pain. The most common thing that causes it, it's called impingement. Lots of overhead activity. The rotator cuff is just rubbing on the roof of your shoulder. That causes a lot of pain. We find that if you can do isolated rotator cuff strengthening, it'll actually pull the ball of the arm down and you won't impinge. So it's very important for that. You know, listen to your body. And again, this is the person going for the first time, or this is the person going to the gym after New Year's. Listen to your body. You know, don't overdo it, especially initially. Don't overdo it, just baby steps. And again, I said NBA game, because in the final game the other night, a guy that was having this calf strain completely ruptured his Achilles tendon.
He was from Wisconsin.
Yeah, he is. Oshkosh. Yeah, we played against him in high school. Yeah. So proper equipment. Shoe wear to me is very important, meaning shoe wear matching the surface you're on. Again, if you have ankle issues, you know, now they make these shoes that have like a little bit of a high top to them. If you kind of have knee or hip issues, they're now making shoes that have a lot more cushion. A Hoka would kind of be an example of that. Are there other equipment things that you can think of that would make a difference? I couldn't come up with a lot.
I do wear a tennis elbow thing.
Very good. Yep. So braces, yeah. Tennis elbow braces, that's good. Maybe knee braces, knee pads.
Do you have to wear different shoes indoor and outdoor?
Well, it depends on the surface. Is it the same surface?
No, like one is, yeah, indoor gym like, or outdoor tennis court like, which is not the same.
Yeah, to me it's not the same. So, you know, a hard court shoe is different than like an indoor basketball shoe, to play on wood. So I think they're slightly different.
I mean, you play with regular pickleball shoes, right? Do you have those?
Yeah, court shoes.
Dedicated? Oh, court shoes? I mean, they have dedicated pickleball shoes now, too.
And but that's good for inside and outside?
Sometimes they have there's a few brands that break out a couple pairs for indoor versus outdoor.
Okay, yeah. do some more.
What does a dedicated pickleball shoe have? I don't even
More lateral
know.
support.
More lateral support. Okay. Okay. All right.
It's got a little, what was pointed out to me, it's got a little round thing there for like rotating like this.
Some of them have that tread like that.
And the ball of your foot,
Yeah.
there it is.
That's how they differentiate.
Oh, that's cool. I didn't even know that. That's cool.
There's a lot of them out there. They're starting to make a lot of them.
There's more and more. I mean, every time I look.
Well, it's the number one growing sport. There's money to be made there
So I
somewhere.
wear insoles too for, actually, I wear insoles. So I always, whenever I buy a new pair of shoes, I put a new pair of.
I'm a huge insole guy. Every pair of shoes I wear, I'm the same way. You know, a long time ago, I was a professional soccer player, so I had some foot issues. So some podiatrist, I stood in the thing, he made a mold at the bottom of my feet. And now whenever I buy shoes, we get the insoles. Yeah, I think that's crucial if you're having any type of foot or ankle issues. And then proper technique. So this could be your tennis elbow, where people are kind of recurrently lifting the hand. To me, proper technique, I see a lot of back issues. Maybe people are kind of bending over like in the kitchen, but they're not bending their knees. Other things you can think of, proper technique. Rest, this kind of goes to what we were saying about acclimate, rest. A lot of these sort of high-level injuries are when people are, they're tired, they're winded. Injuries happen more commonly there because your body's sort of not at its full kind of protective capacity. And then hydration. Hydration, they're showing with dehydration, 80 to 90% of muscles and ligaments and tendons and cartilage, it's water. When you're dehydrated, they're also, more susceptible to injury there.
I think you could repeat the knowing your body part again at the end, because I go into it saying, I'm not 25 anymore. If I can't get that ball, I'm not going to try to get it. It's just, I'm not going to hurt myself to try to. So knowing your, not only your body, but your limitations, I guess, would be.
I totally agree. I totally agree. But that's. It's hard for people, right? Yeah, right. Some people are competitive. It depends on who they're playing. I'm with you, though. I'm totally with you. And I think that's why pickleball is much more desirable than tennis, because, pickleball, you're not moving near as far as you have to for tennis. You're not, full out running. I think those are advantages of pickleball. The issue I had with pickleball is I was a high-level tennis player, and then when I started playing pickleball, I was always expecting the ball to bounce. And it never did. That took a long time.
The thing about equipment too, I mean, people play with a certain paddle and then they see this professional player playing with this other paddle, so they buy one, and then they might even add some weight to it because they heard, well, if I put weight on it, I can get more power or something like that. And you think, a half an ounce, is that gonna make a difference? But it does.
So it makes an incredible difference, and so we all do that, right? Like, I took up golf, and Golf Digest, there was a thing called What's in My Bag, and at the end of every issue, it was a pro's bag and all their clubs, and I'd buy all their clubs, and then I can't even hit them because their stuff is so much, heavier and stiffer. And same thing in pickleball, those rackets, some are stiff, some are flexible, some have more bounce, some have less bounce, but whatever the pros prefer, I think they like a stiff paddle with less bounce. An amateur should have the exact opposite, but that happens all the time. All the time. Questions, comments?
So you talked about itis versus osis?
Yeah, tendonitis, tendinosis.
Sure. So I did pull something, right? So until you had that first injury to me, then now I say I can't get that ball. But I
What,
did-
hamstring?
ten-
Oh, calf.
Yeah. So it still, I am over 50, and it doesn't heal like I thought it should heal. So, I mean, like, should I continue to do those exercises?
So how long have you had it?
February.
January, February, so what are we talking?
doesn't hurt all
4
the time.
months? And it was a calf strain
They said there was a partial tear.
of
The-
Achilles or?
You know what, I didn't have an MRI, I was
All right.
at home.
All right. And it still bugs you?
Sometimes,
Did you go to therapy?
I did at home. I mean, I did do all the exercises.
So, I mean, based on what you're saying, I mean, it really depends on where it is specifically, but I would stretch like the heck out of it. Like, and calf or Achilles stuff, and this is counterintuitive, but the best time to stretch is when you wake up and when you go to bed, which is kind of crazy to me. But when you wake up and when you go to bed. But if I'm you, I'm stretching the heck out of it. I'm probably putting like a heating pad on it. And then I would do a trial and error thing when you play. But I agree, if there's just certain shots that bug you, then just don't do those shots. Because the fear is, and we alluded to this, you have that tendonitis, tendinosis, something's compromised, right? Probably a partial tear. And then if you keep doing it, I mean, it could completely tear, and then you're in the world of hurt. So I think that's smart if you're avoiding the thing that bothers it.
Heat, more heat.
That's me, though.
But that makes
Books
sense.
or ice,
Yeah,
but
it makes more sense to me to put heat and.
For me.
than tighten it, because it's already tight. I mean, that's the problem, I can feel it.
no, you gotta like stretch the heck out of it. Here, I'll tell you something. This kind of blew my mind. So, like a tight Achilles tendonitis, tendinosis, and then what's that thing everyone has in their foot? What's plantar fasciitis? So that's all the same, and then kids get, it's called Seaver's disease. It's where their Achilles inserts on their heel bone. They'll get tons of pain there. So all those things, the Seaver's disease, the plantar fasciitis, the Achilles tendonitis, all of that is a tight Achilles. All of them, that's all it is. Even plantar fasciitis, which is on the bottom of your foot, well, the Achilles continues to the bottom of your foot. So all of those can be remedied by stretching. So I coached this high-level soccer team, like 56ers, I think it was U14, and all these kids had this Seaver's disease thing, where the Achilles inserts, all of them, like my whole team. And we had nationals coming up, and I'm like, what am I gonna do? So we had them all stretching, I had them heating, we were putting the topical stuff on. A guy says, you gotta give them the boot. And I go, what the hell are you talking about? Well, they make it's like a ski boot. They put it on both legs, and then it has a strap where you can raise the foot, and they sleep in it, so the Achilles is stretching all night long. We won the tournament. Swear.
You took the boots off.
All my kids are in a hotel wearing these boots. Yeah, so any Achilles or plantar fasciitis, stretch your Achilles.
What are your thoughts on like dry needling? Because we do that here in Seoul. We can do like a lot of calf muscles and soleus and stuff for that.
Yep.
Do you have thoughts on that? We don't do a lot on yoga.
So personally, I don't have experience with it, meaning I've never had it, I've never prescribed it, but I know lots of people that have had it and swear by it. And then I know 2 people that do it specifically and they swear by it. So I would say,
Can you explain what it is?
Yeah. Oh, sorry.
no, go, please.
So it's different than acupuncture. Like PTs can do it. So So I do it here and another PT does it here. But it's just needles that you insert into the muscles. We direct it toward like the tight spot or where you had the strain. There's certain like areas we can needle. And we insert the muscles or the needles into the muscle. We also have like an E-stim unit we can hook up to the needles to get the muscle to contract. So it can treat like chronic strains, sprains, kind of brings blood flow and healing, tries to normalize that tissue. So, and I don't think a lot of people know we do it here.
Yeah.
Yeah, I use it a lot in backs, legs, even like tennis elbow we can treat or pickleball elbow. Yeah, it's pretty. And I heard now more insurances are covering it, which is good.
And that's good you said that. So pickleball elbow and tennis elbow are the same thing. Again, that's your lateral epicondyle. All the muscles insert on a single point. Repetitively doing that inflames it. Things you can do for that, there's activity modification. They make these great braces for it. And basically the thought on the brace is all those muscles are originating from the single point. So the brace is going to put pressure on a different point. So now not all those forces are coming off that single point. Therapy is good for that. Injections are good for that. And then they do surgery for it, but I don't know how successful it is. And then, so we're saying that pickleball elbow, tennis elbow is the lateral epicondyle, and then golfer's elbow is the medial epicondyle. It's the same exact thing, just on the inside, because they're repetitively doing that. Other questions or thoughts?
I've had this wrist thing that's gone on a long time, but when I sleep at night, or even sometime during the day, it feels like somebody punched me real hard in the arm, like right here. And it's all, I think it's all related.
So you think it's all, okay, I was going to ask you that. So you think it's all related?
Yeah.
Do you have any neck issues?
No.
So I'll just give you my kind of modicum of thinking without examining you. So if someone has a shoulder issue, they're going to say, when I do this, it hurts here, and when I do that, it hurts there. But with shoulder issues, it's activity-related pain they can point to with a finger, all right? And it's just here. But anytime someone says, well, I feel it a little bit in my shoulder, maybe a little bit in my elbow, maybe a little bit in my wrist and hand, as soon as these symptoms travel or are more than just a single joint, to me, I think about you maybe having a pinched nerve in your neck, because if someone does have that, they can feel it anywhere from their neck, shoulder, arm, elbow, forearm, hand, or anywhere in between. You know, someone has a finger issue and it's coming from a pinched nerve in their neck. It's pretty counterintuitive. But when you say wrist in this, that's kind of the first thought I had.
Yeah, certain stuff like that. I sometimes feel like it's a nerve thing.
That, based on what you're saying, that'd be the first thing I'd recommend they look. And sleep at night, at rest, that tends to be more nerve things.
You mentioned some of the analgesics a little bit, but what about Voltaren cream? That's a NSAID cream.
Yeah. So again, we don't have a lot of studies on that, but I think there has been a lot of success. And I guess I honestly don't know. In a lot of the topicals, I know the main ingredient is the capsaicin. I don't know what the main ingredient is in the Voltaren.
It's an NSAID. I'm not sure.
Just not sure on that. Yeah.
One more question on my side, and I'll ask my own surgeon, but when I come back from my knee, I mean, would you suggest wearing a brace for a while just for a confidence thing, or start back playing? Or not necessarily?
How far out from surgery are you going to start playing?
I was hoping for 2 months. I mean, not totally competitive, but off the playing.
Who did your knee? Can I ask that? Keys, yeah, Keys. So really, The only indication for a brace would be if you're having instability. So if your leg is going a little too much into out, or if your leg is going a little bit too much front to back, then for that, we'd recommend a brace just to prevent instability. But if you're not having instability, which I suspect you aren't, you wouldn't need to wear a brace. And in fact, on these total knees, if everything's done perfectly, which if it's Dr. Keyes, of course it was done perfectly, I think range of motion loss tends to be the biggest potential negative thing. So you wouldn't want to brace for that either. They almost, want you to use it to kind of get that motion back.